This meeting to order for the
Right.
Board of Health for December 17th. Do we have or do we want to go around the room and introduce Chair
Sure.
Jim Whalen?
Dottie Bernard.
David Ropeek.
I'm Katie, the new public health nurse.
Oh, okay.
Kimberly Lombardo, the new health, the new health, coordinator.
Hey, welcome both.
And I'm Melanie Deneen, the public health director.
Oh, good. A lot of new faces. That's
Mhm.
good. Yeah. Welcome, guys. Yeah.
Thank you.
We've heard a lot about you, so this is great. So do we have a call to order for a second or a vote to start
Make
the
a
meeting?
motion, start me.
Okay, and a second?
I agree that we should start the meeting.
Excellent. All right, so we have our meeting underway. I guess the first order of business would be the approval of minutes from November 3rd, 2025. And I have to say they were the most involved and well-written minutes that we've had to date, I would say. Do you think? I thought they were pretty.
Yeah.
Pretty
And
well
I
done.
would like to just add to them. Thank you, Melanie, for doing the homework that I set upon you unexpectedly in last meeting on
Right,
the
it's,
status of cutting stones. And,
Oh, the stone
Yes.
cutters.
Mhm.
Sure, yeah.
you know, we'll
Excellent.
talk about it later, but it was in the minutes. Thank you.
Yeah, it was excellent. Yeah, so I don't have any changes. Do you have any changes?
They're gonna make a motion to approve the minutes as written.
Okay.
I second that.
Okay, so the minutes are approved as written. And that would move us along to our third item, which is 141 Katarina Heights septic system failure. I know that we've kind of been back and forth with these individuals. Melanie in particular has been back and forth and try to work with the homeowners to try to get a solution to the problem. I know they are trying to work in some ways with us to try to get a solution. But do you want to, Melanie, kind of take us through it and just
yeah,
give us the highlights of what we've been doing with them at this point?
we have record of first receiving, a septic system, in February 2004, we received like a complaint of an odor that
2004.
2024. With visual inspection by the health division, we requested and ordered them to do a Title V inspection to confirm what was happening. On February 6th, with a 5-month deadline, and they did submit within 2 weeks of failed Title V in February 16th, 2025. That was approximately a year later. We have about 4 to 5 complaints throughout 2024, and we gave them an order of non-compliance on January 30th of 2025. So we officially said, you're not in compliant, your system 6 is in failure, you haven't fixed it.
Quick question.
Uh-huh.
Were the complaints from a single source or multiple sources?
I don't have record of every single person who called and complained. Okay, people were anonymous, so we take anonymous complaints. They called and complained that the septic system was smelling, is a mess in their yard. We confirmed. You can see it on the satellite GIS. There's a big puddle or a green spot in the winter or a brown. It's been was unclear in the beginning, but it has become more and more apparent over time. We sent them an order to become non-compliance, and then we sent them an order letter in September. And they did do a soil evaluation and perk test on October 23rd. But since then, we have not received a septic design to date. Mike has been in this might be them. Mike has been in conversation with their engineer, and we know that it's in progress, but we don't know. We don't have yet submitted a Title V report or a full septic permit design ready to go. Okay.
Hey,
I have a procedural
Oh, yeah, no
question,
problem.
Mr. Chairman.
yes, sir.
I know Janine and I've been to the house many times.
Oh, okay.
Does that mean I shouldn't participate in this? I mean, what are we gonna do in the Board of Health? Because we all know everybody in town, or lots of people in town, but I wanna put that on the table.
Sure, I think, in that case, you could probably recuse yourself now that we have another member present that
You covered.
has arrived. Yeah, I think we have enough to still be able to vote.
I need you to ask the person on the iPhone to identify themselves.
Oh,
They're
sure.
on an iPhone, so I need you to have,
That's me, that's Portia.
so I need,
Oh, Portia's here too. Okay.
Sorry.
member of the board, you have to have your, video on.
Yeah, remember my sister just gave birth, so I'm here for assistance, but I'll have to listen in. It's up to you guys, unless you want me to.
Maybe, she can listen in. She can obviously act as a board member, but maybe not vote.
I don't know, that's a new protocol for me,
Yeah,
I'm not sure.
maybe since we still have on this item, we still have three.
Yeah,
members
I mean,
that
I'm
are
not,
Able to vote. Portia.
okay, as long as it's Portia and
Congratulations.
I'm not, it's not someone else, cause I'm trying to see.
Yeah, is there
Um,
Oh,
anybody
you
else?
need to just see me for
No,
originally?
just
Can
wanna
I?
know who else is
Hi.
the meeting. Who's Margaret R?
We just want to make sure that there's no, that, the people that we've called in front of the board this evening are potentially in conference call with us, and I don't see, usually you see names involved, like on the screen that would identify each
At
person.
least on my end, what I'm seeing in the meeting is me, second floor meeting room, Katie Rhines, Kimberly Garcia, and Margaret R.
Right,
Okay,
Kimberly and Katie are the next presenter. I don't know who Margaret R is.
Okay.
Okay, and they're not identifying themselves, so, okay, there we go, moving forward.
okay, so moving forward, at this point in time, because we don't have a plan, I think we need to kind of take the next step. And to do so, first, I think you want to take, should we take a public comment on the
You could.
situation, or anybody who'd
You
like
could
to
hear, you could have,
comment?
Mhm.
Or is there anybody else other
any,
than David that would like to comment on this issue, or read about it, or has any questions for Melanie about the issue?
This is when I can comment or not.
We're gonna have you comment in just a moment. We'll have you just identify yourself, and then you can add in, but I just wanna make sure that just based off of what Melanie's, just to bring Randy, just to bring you up to speed on what we're
Thank
doing.
you.
Yeah, it's the 141 Katarina Heights septic system failure. And where the board, where the Board of Health has been kind of involved to this point. It seems like this is dated back to 2024. There's been several neighbor and abutters complaints about odors and just the general untidiness of the area. Melanie's been back and forth with the owners for different plans, which they have given you soil testing.
they conducted on October 23rd, then, in order to do a design, you need to do a soil test and what's called a perk test, that's the water, how fast the water flows
Sure.
through that type of soil. And that was done on October 23rd.
And what we were actually looking for to today's was a formalized plan.
We would like a DSCP or a Form B, a septic plan that we could review.
Okay. They did not supply that, the owners of the residents did not supply the plan as requested. Which brings us to tonight, where we have actually called the owners in to discuss the matter. And as far as we know, the owners of the property have not appeared to us this evening.
Yeah, they had told me they were gonna come in on Zoom. So I've just asked, somebody's black screen just came on. I don't know if that's 141. You have to unvideo and unmute.
So what we're trying to, I guess, work that through, is there any questions as far as what we're looking for these individuals to be in compliance with our
And as listed here, so it seems that the current status of things is failure to comply.
Correct,
Yes.
they have not submitted, I mean, it's still in failure, there's still a big puddle in the yard of a breakout, it's called, so the leach field is no longer working, and so the septic is out on the top of the ground.
Got it.
I
Okay,
drove by residence maybe a month ago. Before there was snow cover and it looked pretty significant. It almost looks like a pond, like a shallow pond on front of their lawn. So, they have a pretty big driveway and right to the left of it, right on street level. But actually away from the house, it looks like, they have a situation going on there.
and, you know,
So I just want to say, I also drove by just because I wanted to see how close it was to the road. I looked at the GIS, the Google Earth map, but I wanted to see exactly how close it was to plot lines in the road.
What did you think? I thought it was pretty close to the
Very
road.
close.
Yeah,
so as an order of non-compliance is 2 years to repair. Just for, like, that's standard in the code. But since we've given them an order letter, we've told them that you're in, you're a public health nuisance, you need to do something faster because of we started with okay, it's not working, it's failed, you haven't submitted a new plan. We told them they are not in compliance, but then it became more and more of a nuisance with more breakout. And then we said, we sent them an order to be before the board, and this has become a nuisance, so that, we want faster action. But we have not received, some action, but not definitive.
the appropriate action. Okay.
One of the challenges right now is the weather. So we just have to, when you're deliberating this, you take it into consideration. Many septic installers, they're finishing up for this cold season. Because once the ground is frozen, it becomes very difficult to dig because your pile can freeze. Like, it's hard to install. The soil can become frozen. The piles that you put aside can become frozen and it becomes problematic. And so the installation becomes very weather dependent.
Can I ask a procedural question?
Sure.
In general on these sorts of things? So they did something in October.
They did a
but
soil test.
You're still waiting for plans.
They have to submit a design
Design. right,
by an
design,
engineer
Design, right. Yeah.
for what they that we review, make sure it's in compliance with the code, and we issue a permit.
So my question was, because I don't have these things go. Could they not do that even though the ground's frozen?
Oh, no,
Design?
they definitely should.
Design.
And they could submit a design, and I want them to.
I didn't know that was dependent on frozen ground.
If they had submitted a design, I would have considered that progress. But they haven't submitted a design.
But they can do that even though the ground's frozen.
Right, they
Not
can
to take
submit,
it, but,
they may not be able to, form if you said you need to get in a timeline, you set a timeline, they may not be able to install, is my point, so it's nicer weather.
And
No.
how long?
Oh,
Did
sorry,
they,
I was just gonna ask Melanie, is it like a immediate public health concern for the neighbors? Like, is there anything that they can do during the winter, at least protect, I don't know if protect the neighbors?
So they are pumping regularly,
Okay,
it is an odor issue. And it's unsightly, and it's not treating the wastewater, so the septic is on the surface of the ground, it's not,
yeah.
they need to fix it, like I've told them they need to fix it.
how much notice did they have for attending this meeting?
Well, they were told last week. And the card came back signed, so they've given at least 5 days notice as required.
So, it seems very clear to me that they're in failure to comply and that we should proceed with the legal enforcement as listed.
I think that's an option.
Before we vote though, I think, I'd like to just hear from one of the abutters or any other public comment. Before we kind of hold the vote.
Okay.
Is that okay?
Yeah.
Anybody else on the board? Everybody's pretty comfortable with what they're hearing? Yeah.
Yep.
Okay. You good, Portia? Yeah, okay. So, at this point in time, I want to direct it over to, I'm sorry if you would just say your name and your
Yeah.
address.
So I'm Margot Hudson. I have lived on Kettering Heights for a long time. At 116, which is right directly across the street I would say that this has been a problem for many, many years. I certainly was one of, I would say, I kept thinking, of course they're gonna fix it. Of course they're gonna fix it. And this is probably 2023 anyway. I certainly was one of the people who started complaining in the beginning of 2024. I know I am not the only one. I know that an abutter to them has told me he cannot even sit in his backyard because of the stench. This has gone from being, just so you get like an idea, it has gone from being like a little puddle to being probably almost as big as this room. So it is really a poop lake. It is just floating black, brown sludge. They are right on a ravine that drains into conservation land. And, you know, you're asking how close is this to the road? It's not even just to the road, it's to the drainage, the main drainage that goes into the old white rifle range. If you can look at those maps, you'll see they are right there. So I have no way of knowing if any of this gets in there, but if there's a heavy rain or a big snow melt, this all bubbles up. And that's the drainage. This will drain down into the rifle range. I mean, that's the big drainage pipes. That's why they're there, to drain the snow melt. So I think it is, it is a nuisance to have the smell, to not be able to go outside. It's like an embarrassment, people walk on our street all the time, but it is a true health risk for any animal that walks across this. I can't even imagine for anyone's dog or a squirrel or a child who wants to just go play in the mud. This really requires immediate attention. They have known for many, many years that this was a problem. These are not people who are struggling. They have so many people who live there, so many cars, so much human waste that they are generating, that they're putting into their front yard, that and they have known about it for a long, long, long time. And it's not like they're just saying, oh, that's what all that sludge is in the front yard. They have known about it and they have refused, I think, they're not even here, to really address it. So, I know who was the health inspector who went in October, and he said, because he's the one who told me about this meeting. Anyway, the main Board of Health inspector who goes out, he's the one who went out in October. He could hardly stand doing whatever testing he was doing. And you would think that they would have arranged to have somebody fix this long ago. So. And
Thank you. Yeah, excellent. Thank you. Okay, so it sounds like they've been not in compliance for quite a while. I think at this
Since
point-
I've been aware of it, documented that with the complaint we have is in February 2024, we first became aware of it. And we've been sending them letters and following up. We've all inspected there. And it has not been repaired.
Okay, and the fact that they're not here this evening, it's now 7:20, I would say, somewhere in that ballpark. I'm gonna assume that they're not gonna be attending the meeting tonight, so I probably would move ahead, like Dr. Crane said, about assessing a daily fee.
Okay.
And I would probably, just based off of the amount of issue that is going on there, that we probably should do a maximum fee to start and not scale it up. So do we know what that is?
Well, it's $200 per day
Okay,
is the maximum fee.
yeah,
I think I would recommend you vote and determine it a public health nuisance. So
Okay.
as part of that declaration that gives the authority to assign the fee.
okay. So I definitely think it's a public health nuisance. Does anybody
So I would make a motion to identify this as a public health nuisance.
Okay, and we
I
have a
second the
second,
motion to identify it as a public health nuisance.
okay, and of the, I guess, can she vote or,
Yeah. I think
Portia
so.
vote?
Here, just
Say
one-
Portia.
I'm
Alright.
here just with the baby.
You're on the vote for this.
I vote in favor.
Okay,
In favor.
in favor? Dottie?
Yes, in favor.
In favor, okay, and
I'm officially recused.
you're recused, okay. So all in favor, it sounds like it does pass. And again, I think, should we vote on the fee to be assessed?
Please.
At this point, just hearing the evidence and, the situation, seeing the situation, I would recommend a 200, a day until they at least have a plan in front of us.
Okay, that was gonna be my point of clarification.
Yeah,
Like,
and I
what is
think-
that? What is the
Yeah.
standpoint?
And I think once they have a plan and we could probably readdress it at that point about when they're going to actually fix the problem,
Mhm.
whether that be no later than April 1st. You know, we could probably say a time like that.
Mhm. Okay.
Sometimes so they have plenty of time to plan it, get a contractor and implement it, I would say no later than April 1st. But again, we could readdress that as the time, but let's take a vote now on assessing the fee of $200 a day until we have a plan in front of us or it has been submitted to the Board of Health. Would you like to make
I so move.
I second.
a second? Okay, so we'll take a vote, Portia.
Yep, in favor.
Okay,
In favor.
in favor, so it passes. So we'll be assessing at that point.
All right, next, on our agenda. I wanna introduce, in your packet and on the table in print form. Is a project conducted by our, Great Meadows Public Health, epidemiologist. Kimberly Garcia
Hello.
and our Great Meadows Public Health nurse, Katie Rhines.
Hello.
They worked for great many hours and time to work and put together the health equity needs assessment for our region. And they are here tonight to present to you the data for their findings, what they have specific for Concord and whatever else. So I'm gonna turn it over to you to start.
Can I share my screen?
If I could figure out how to allow, yes, let me, renames, make a co-host. I make you a co-host, you should be able to share.
Yes, can I grab one of these reports?
They're for you.
Okay, thank you, and
I have it digitally. There you go.
All right, perfect. Thank you for having us. As Melanie said, I'm Katie. I'm the regional public health nurse for Great Meadows, and Kimberly is the epidemiologist. So you have the hard copies of the report in front of you. You also have a PDF copy, but basically this is just a summary overview of our findings. So there's more details within the report itself. And so this was a regional effort across the 7 towns to identify health equities, listen to our community voices, and analyze the data from the Mass DPH CHI survey. And our overall goal was to guide strategies to improve health equity and well-being within our communities. And so our team was made up of 4 people, Brandon, our program manager, Kimberly, the epidemiologist, me, and then we also had a graphic designer.
Excuse me, Katie.
Yep.
All right, there you go. I was, your screen on your computer was kind of blocking your
Yeah.
slides. So there you go.
Yeah. Can you see it okay?
Yeah, now we can. That's better. Thank you.
You're welcome. So for the methods, just so you have a little bit of background, we used both quantitative and qualitative data. Main sources were from Mass DPH, specifically their CHI survey, which was their community health equity survey, the CDC, the US Census, and Emerson Hospital. And we really tried to engage the community itself. So we did a lot of surveys, key informant groups, focus groups, and we did some shelter outreach at both the shelters in Bedford and Concord. And our main focus was just the health inequities in preventative care, chronic disease, and societal factors based on Mass DPH's foundational public health services model. And just so you have a little idea about what the CHEES survey topics were, it was COVID-19, such as vaccination and long COVID, information sources like where people get their news, education, basic needs, access to healthcare, employment, mental health, substance use, safety and social contexts, their demographics, and their neighborhood.
All right. Hi, everyone. Again, my name is Kimberly, and I'd like to thank you for your time this evening. Now, just to dive in, this project aimed to assess the public health landscape of Great Meadows following the initial waves of COVID-19. So we used Maven data to report case counts and deaths. The cases from Maven were from January 2022 to May 2024, and the death count is from January 2020 to June 2024. And just keep in mind that case numbers from January 2022 to May 2024 are likely underreported due to widespread at-home testing. Next slide, please. So vaccination rates for the primary series are high across all towns. This, as just a reminder, this vaccination series was first released in early 2021. However, booster uptake is lower. Only about half of residents have received a booster since 2022, and that data is from April of 2023. Current public health guidance from Massachusetts DPH recommends COVID-19 vaccination for children starting at 6 months and up. All adults, high-risk individuals, pregnant or lactating people, and those who are immunocompromised. Immunocompromised individuals should receive 2 doses of the 25-26 vaccine spaced 6 months apart. And as COVID-19 continues to circulate, long COVID remains a key concern. Long COVID refers to a range of non-specific symptoms that can appear up to 3 months post-infection, which include sleep issues, stomach pain, joint or muscle pain, tingling sensations, and dizziness when standing, and some other symptoms listed on the slide. A New England Journal of Medicine study showed that vaccinated individuals were less likely to develop long COVID than unvaccinated individuals. So given Great Meadows' high vaccination rate, it's unlikely that the statewide 5.3% long COVID prevalence applies here. Still, we must remain vigilant and aware as booster uptake is low. Some individuals with long COVID experience chronic symptoms and report difficulty accessing care. So this highlights the need for continued investment in chronic disease surveillance and further probing of the community to see if something like long COVID support groups would fulfill a need. And COVID-19 also reshaped work patterns across the region. So according to CHI data respondents, hybrid work is more common for half of the respondent populations in Great Meadows. A fifth report working exclusively from home, while about a third works exclusively at an office outside of the home. So these shifts have implications for mental health, social cohesion, and access to services, which are important to consider for public health planning. Next slide, please. All right, so moving on to mental health. Post-pandemic, studies have shown that mental health indicators have worsened since the pandemic. This has occurred amongst those who were infected and directly impacted by COVID-19 and those who did not directly experience the effects of the disease. A study done by CDC Places indicated that on average, about 18.2% of adults in the Great Meadows region reported exhibiting symptoms of a depressive disorder. This is a little lower than the Middlesex County average of 19%, but it's just still something to be cognizant of. Survey findings from the CIVIS survey in 2023 revealed variability across Great Meadows and an individual's access to support systems. Amongst white and Hispanic respondents, a notable proportion reported lacking one or more key components typically associated with a functional support system, some of which are, I have a friend or family member who I can count on to be there for me. I have a community that cares about me, and I have a sense of belonging to the community where I live. So many indicated missing at least two aspects of what makes a strong emotional support system. A positive is that a large majority of respondents in the youth risk behavior survey, that is of respondents that are from the ages of sixth graders, eighth graders, and high schoolers, of which 30% of respondents are from the area, indicated that they felt supported by either their friends or their caregivers, parents, family, etc. However, those that did not feel that they were supported were more likely to also feel depressed and reported engaging in self-harm behaviors. So according to the YRBS, those who identified as transgender, non-binary, or non-heterosexual and certain racial or ethnic groups reported not feeling like they belonged in school, being bullied, being depressed, or engaging in self-harm at a higher rate than their white classmates. So the racial or ethnic groups of the survey identified especially at risk are Native Hawaiian or Pacific Islander students, Middle Eastern American students, Black or African American students, and Southeast Asian American students. And so moving on to older adults, according to the US Census, about 25% of older adults in the region live alone. This can be especially concerning for older adults with chronic conditions or who are developing conditions, as there isn't a strong community presence to identify if someone is deteriorating mentally or physically sooner. A key informant noted in their interview that the community just isn't gathering the way that it used to pre-COVID. And something that came up during a key informant interview that I think is important to note is that when we talk about mental health issues, we just need to remember the complexities of mental health care. A key informant reported that when they made use of funding to offer mental health services, people who reported interest in receiving care did not show up to participate. So we need to really ask ourselves what stopped them. Is talk therapy the service they needed, or is it another type of therapy? So we really need to glean what the community is looking for exactly and what the barriers are that prevent them from showing up, and if it is possible for us in our roles as public health professionals to remove those barriers. Next slide, please. And so moving on to substance use, the 2021-2022 National Survey on Drug Use and Health estimated that about 23% of Massachusetts population aged 12 and up engaged in binge alcohol use in the last month. The survey also estimated that about 32% of the Massachusetts population aged 18 to 25 had the highest proportion of binge drinkers. And CDC Places estimated that in 2021, about 16.8% of adults in Great Meadows engaged in binge drinking in the month prior to taking the survey, which you can see Concord's number is there, 16.9. Alcohol can compound emergency visits, so it is a substance of concern. According to the YRBS, high school students that reported consuming alcohol within the past 30 days decreased from 27% to 13% of students over 4 years. However, the number of students reported using alcohol increases as the grade level increases. The number of students driving under the influence of alcohol dropped by half, from 6% to 3% over the last 4 years. And moving on to different population group, older adults can have substance use disorders and are less likely to be screened for it. There are misconceptions that older adults with a substance use disorder have had it a long time, but a substance use disorder can develop at any time. Stressful life events were associated with alcohol use disorder in those that are middle-aged, so effective screening, social support, and available primary care are some key factors that can help with prevention. As for opioids, Great Meadows has a low opioid death rate, and the opioid-related overdose deaths decreased 10% overall in the state in 2023, which is a trend lower than the nationwide rate. Massachusetts credits local and state efforts in substance use disorder prevention, treatment, and recovery for the decreased rate. And I'd just like to briefly mention two other substances of concern. Tobacco CDC Places estimates that 6.9% of the population in Great Meadows are current smokers. Unfortunately, DPH's tobacco dashboard did not have the exact numbers for Concord only at the time of the report. But e-cigarette use does continue a downward trend among high school students from 8% of high school students to 5%, reporting over 2 years. Of the 3% of the student survey population that engaged in e-cigarette usage, 20% identified as Native American or Pacific Islander, which I think is important to note. And just another substance of concern for marijuana, since 2020, the rate of high school students driving under the influence of marijuana dropped from 14% of respondents to 4% over 4 years. Marijuana usage is also on a downward trend among high school students, dropping from 10 to 6% over 2 years. And of the population who used marijuana recently, the survey considers that within the past 3 months, 25% identified as Native Hawaiian or Pacific Islander, 11% identified as transgender, and 10% identified as Middle Eastern American, and another 10% identified as American Indian. So while keeping in mind that identities can overlap, we can estimate that it's about 45 to 56% of respondents that answered affirmative that are of a minority population. So we need to really consider if prevention messaging, if it's effectively reaching these populations. Next slide, please.
All right, so moving on to access to care. So generally, Great Meadows shows pretty high preventative service use and low uninsured rates, which is great. For Concord specifically, for those up to date on preventative services, age 65 plus, men is around 55% and women 48%. And for uninsured adults, 18 to 64 years of age, Concord is at 2.7. And to keep in mind for Massachusetts, the statewide rate is 2.4. So the affordability of care is still a challenge that we could focus our attention on.
Katie, we have a question.
Yep.
Is that data based on what year?
That one, I would have to check to be sure. I don't want to tell you the wrong thing. So I can let you know after.
Okay.
But some key points for mental health care in Massachusetts, or access to care in general. We know that mental health care is increasingly challenging, as Kimberly had said. That is not, isolated to Massachusetts or Great Meadows itself. That's a nationwide problem. But it's largely due to shortages in mental health providers after the pandemic. So during a focus group for this needs assessment, we had multiple participants that had mentioned that it was COVID-19 specifically that made their access to providers had reduced it. So telehealth does seem to be utilized by some of the residents in the towns. Based on the CHI data, we found that in Bedford, as you can see, the sample size is listed by the towns, but the usage rate ranged from 53.5 to 61.8%. And around 11% of the Great Meadows population does not have internet or has internet that does not work well. So we need to keep that in mind when we're doing public health programming and how to reach that population. So going back to the CHI data, we found that around 20% of Great Meadows, the population felt that their mental health needs were not met. And 2.4 were experiencing suicidal ideation within the past year. 16% of parents felt that their child had an unmet mental health need, and 45.3% felt that they had medium to very high psychological distress in the past 30 days. And some challenges and barriers to care are the three big ones are transportation, affordability, and language access. In Lincoln, 14% of uninsured individuals were Asian, and almost 9% in Sudbury were Black. In Concord, 1.33% of the male population is uninsured, and in Wayland, it was 1.62%. And as I said, 2.4 of Massachusetts residents were not insured in 2024. So for those who were not insured, nearly half of them were mentioning the cost as their primary barrier. and almost 20%, over 20% were uncertain about how to obtain their insurance. So there's definitely work to be done there.
Katie,
And
can I question? Yeah. Katie, the barriers, transportation affordability and language access. I don't see any reference there to what in my head I'm thinking of as stigma. That the availability of the care may be there, but the way that it is used causes the people to not trust that they'll remain anonymous or other things that will help break down the barrier of fear stigma. Is that a barrier that needs to be thought of? I can only imagine. I'm not an expert in the field, but you know, if you have to go to some physical place to see a person, you're afraid you're no longer anonymous. So is the way the care is being offered a question? Does it raise a barrier question?
I think stigma most definitely always plays into health equity for sure. Yes.
But more specifically, and I'm clueless about it. Admit that cluelessness. Does the way that available care is being offered ensure maximal anonymity or trust protection to reduce that as a barrier?
You mean in like going to the PCP or like your OBGYN?
Yeah, like I'm thinking suicidal thoughts or whatever, dark thoughts. Do I have to go somewhere? Do they take the name? You know, are there a number of tripwires that would raise the stigma barrier in the way it's actually happening out there in the real world?
Oh, yeah, I would say definitely. And especially my background is I used to work in the emergency department as a nurse. And I think going to the hospital saying that you're having, you know, suicidal ideation, there is stigma. You're separated, you're kind of pulled out, put in different clothes. Like, I think a lot of people don't want to talk about it. And I think it's a big problem. Yeah.
I think, Mr. Ropeik, it's hard to capture in a survey because
Yeah.
by default, people with those types of concerns don't fill out a survey,
Or give you honest answers on them.
right? Like population for this CHEI data for Concord was less than 20 respondents for
Right.
the states, you know, but they worked hard to get additional focus group and additional content to, you know, kind of round out that data representation, but it's, you know, it's a very hard, like if men in general don't fill out a survey, you're getting unrepresented data. This was the same thing with our needs assessment. We didn't get people, they were afraid we're gonna track their answers through the computer. Same with this survey. When we presented it, when the state CHEI, with that survey was out, we did try to promote it here. And they thought we were gonna check their computer and track them down.
Right.
So even that barrier to get the answer, to have them fill out the survey, to even hear that information was hard.
Yeah, this is why I'm raising the broader barrier
But
question.
they told, I had some not good data, these people would not like it, did like feedback, like, I don't wanna answer those questions, Melanie, I don't want you to know. It's very personal questions in our needs assessment. Does, I don't know the answer to try to, can't address the problem if you don't understand the kind of like Kimberly was getting into, like, what is it they need? Well, if they don't tell you, it's really hard.
Yeah, I mean, there's a huge aspect to that. And with the CHI data, like with that survey specifically, they had the option to skip questions if they weren't comfortable answering it. And we would still include the questions that they did answer in the final, you know, their final submission. I did want to go back a slide just so you could see here. So we had a sample size of 293 experiencing suicidal ideation within the past year. So, I mean, one could think that if 293 people answer that, we don't know the number of people who skip that question. So that is a big number, just for, you know, the survey itself. But like Melanie said, it might not be something that people wanted to answer. I hope that answers your question.
Yeah, thanks. I mean, it raises an issue, but yeah, thank you.
Yeah, I know it is a big problem. So overall, the challenges that we found in access to care were mental health, dental care, and preventative screenings. So a lot of the residents that we spoke with emphasized their affordability and mental health as their main priorities for health initiatives.
All right, I'm going to present on built environment. So overall, residents are really happy with their built environment. They're really appreciative of the safety of their towns. The crime rate is low. And multiple surveys, the respondents did confirm that they both felt safe in the community. The area also features a significant amount of green space, which is great for mental and physical health. Green canopy apparently covers a little over half of all of the towns in Great Meadows, which is higher than, of course, the state of Massachusetts and the United States average. However, we did identify a few gaps. Transit options in the area are limited. The area is car dependent, and most errands do require a car. Car dependence has been linked to obesity and high blood pressure, and some mental health issues and car-related fatalities. So reducing car dependence decreases air pollution and greenhouse gas output. The ability to walk around a neighborhood and the availability of public transport have been linked to higher satisfaction with the neighborhood and reduced feelings of loneliness. So if we really want to target the 25% of older adults that did report to us that they did feel lonely or that they are lonely, reducing a community's car dependency does help with that. Residents did report seeing and experiencing signs of climate change. The past 9 years have been the warmest on record. So encouraging green initiatives that strengthen environmental resiliency in the region will be essential to meeting the evolving needs of residents. Next slide, please. And so the median home price in Massachusetts is a little over $587,000. So this monthly mortgage payment is the third highest in the nation. The average rent in Massachusetts is a little over $1,800, making it the fourth highest in the United States. So according to the US Census, the median rent in Great Meadows is actually higher than the average rate in Massachusetts, a little over $2,000 in 2022. A common budgeting tip for renters is to spend no more than 30% of their gross monthly income on rent. However, as you can see from the slide, at least a third of renters from all towns are spending over 30% of their income on rent. In some towns, it's half of renters that are overspending on rent. Elevated rental costs contribute to financial strain, which is associated with adverse health outcomes when compared to populations not experiencing housing affordability stress. Moreover, housing insecurity often intersects with food insecurity, which compounds the challenges faced by vulnerable households. The majority of CHI survey respondents did report that they had someone that they could count on to help find housing, suggesting residents had a support system in that sense, either interpersonally or in the community. Local health departments in Great Meadows do dedicate a significant amount of time to housing related challenges, I think as was covered earlier this evening. But something just to be aware of in the state of Massachusetts is that homelessness is on the rise. And in 2024, there was a 54% increase of houseless individuals from 2023. Just to note that this number does include new arrivals to the country. Next slide, please. So in moving on to food insecurity, in the state of Massachusetts, 34% of households reported experiencing food insecurity in 2023, according to a survey conducted by the Greater Boston Food Bank. So if you drill that down to only Middlesex County, that percentage drops to 27% of survey respondents. The price of food is increasing. So studies have shown that people opt for food of lower nutritional quality if it's less expensive. But an unhealthy, highly processed diet has been linked to mental disorders such as anxiety and depression. So poor diet has also been linked to physical diseases like Alzheimer's, obesity, and diabetes, and other negative health outcomes. Farmers markets do increase community access to fresh, nutritious food and can promote awareness of sustainable farm practices. which fosters stronger social connections within the community and contribute to local economic growth. Produce from farmers markets doesn't have to travel as far to reach the consumer, which is has a positive environmental impact by reducing carbon emissions. That produce also has higher nutritional value than produce shipped from a distant farm. So there are 3 farmers markets in Great Meadows, and there are also farm stands in Concord that do take SNAP, which is really great. There has been some assistance rollbacks from the federal government. So, for example, the Families First Coronavirus Act increased the benefit allotment of SNAP recipients to the maximum allowable amount. That's been rolled back, and also school lunch programs. So that's something just to be aware of. And just another matter when we talk about food insecurity is we should really concentrate on older adults. Lonely older adults are very vulnerable to food insecurity. With the cost of living rising, many will go without just to address their basic needs. Studies have shown that educating key vulnerable residents on better nutrition can reduce household food insecurity. Older adults are just as capable as any other demographic to changing ingrained habits and adopting a healthier lifestyle. Next slide, please. And so we found these maps on the Massachusetts Population Health Information Tool. So the map on the left is population with limited food access, and the USDA categorizes over 50% of the population of a few of the surrounding towns as having low or limited food access. Now, this is concerning just when you combine that fact with the fact that there's a lot of fast food restaurants in the area, which is the number is 79.29 fast food restaurants per 100,000 residents, which is higher than the rate in Massachusetts and in the United States. So we really need to look at creating environments that promote and support healthy eating habits, as this is foundational to empowering communities to make informed food choices. Next slide, please.
Can I ask about
Oh,
food
yeah.
access?
Yeah, sure.
There's been a bunch written about supermarket, super center, or large grocery store being the standard, since in a lot of neighborhoods, in some communities, there's a food store in every corner. It's just not large.
Mm-hmm.
Doesn't have the same kind of food availability, fresh vegetables and all. There are price differentials between large super centers or large grocery stores. But is it your sense that there's a food, you're using the word insecurity, I'll use the word access issue in the Great Meadows area?
Desert, it's called the food desert.
Yeah, deserts is one word. Here,
In Concord, I would say no. In Concord itself, but I am concerned by the trend in surrounding communities, and I wouldn't want that to happen in Concord.
thank you.
Yeah. Next slide, please. Okay. And so moving on to communicable disease. So outside of COVID, the flu makes up the vast majority of the caseload in Maven, so it is a high burden disease for residents in the area. And part of the problem with preventing flu and COVID-19 spread is that hosts can be contagious before symptoms appear. Tick-borne diseases like Lyme and HGA also add to the communicable disease burden in the area. Tuberculosis does pop up in Maven, but a closer look at the numbers show no active cases, and well, at the time of the report, no active cases. There wasn't really concern due to tuberculosis disease mechanics. A lot of those cases were either latent TB or false positives. And just some tips for preventing some of the higher circulating communicable diseases is encouraging flu vaccination, encouraging self-quarantine to stop the spread, hand washing, masking, all the things that was encouraged during the pandemic are still valid strategies to stopping this spread of disease. Also educating people about tick prevention, like wearing long pants, long shirts, encouraging repellent use, and also educating gardeners on tick attracting plants and tick resistant alternatives could also help reduce some of the spread in the area. Next slide, please.
Okay, so moving on to vaccine preventable disease. As you all know, vaccines have reduced the global burden of these diseases. Some have been eradicated. For us in Great Meadows, we have pretty strong pediatric coverage. The COVID-19 booster uptake remains low, as Kimberly had spoken about. And it kind of boiled down to an equity issue. There are some gaps in the environmental justice population and non-English speakers. So just for public health professionals, I think making sure that we push the recommended schedules and making sure that it's accessible to everyone is important. So now we're going to go through chronic disease and prevention. The first one we're going to start with is obesity. So the prevalence in Great Meadows is around 20% of adults. The Massachusetts prevalence rate was 27.2. United States is 42%. So we're definitely below that. In terms of variation between the towns, Bedford was the highest and the lowest was Weston. So Concord was in there somewhere. And for disparities, there were higher rates among those who are Black, Hispanic, Latino, and the lowest was among Asian adults. And so the impacts of obesity, we know it's linked to diabetes, heart disease, and cancers. For Massachusetts, in 1 year, the costs can exceed $3.5 billion. So there's definitely room to improve there. And some prevention efforts that the state does is Mass in Motion, and that's for a school-based program. And then we also have other school-based nutrition and physical activity initiatives. So those can be done by local health departments as well. And then for diabetes, around 8% of adults in Great Meadows, that was the prevalence rate. In Massachusetts, it was almost 12%. And for the town variation was the highest in Weston and Wayland, and the lowest in Lincoln and Concord, which is great. And so again, for disparities, it was higher among Black and Hispanic individuals versus white. And the impacts, of course, it doubles healthcare costs, and it's linked to our other chronic diseases such as heart disease, kidney failure, and blindness. And some really good prevention efforts done by the state. They have a diabetes prevention program, which really promotes healthy lifestyle changes such as diet, stress, and exercise in the community setting. And for cancer, around 20% of deaths in Massachusetts are related to cancer, which is similar to the heart disease percentage. The prevalence rate was around 426.7 per 100,000 in Great Meadows. And you can see the Massachusetts rate and the United States rate right there. And so for town variation, it was highest in Wayland and Bedford and lowest in Carlisle and Sudbury. The most common cancers for men were prostate and lung, and for women were breast and lung cancer. And for disparities, the white residents had the highest incidence rates, but Black residents faced higher mortality and later stage diagnosis. And Hispanic and Latino and Asian residents faced barriers in screening and treatment. Great Meadows does have a pretty strong screening rate for mammograms, around 85 to 90%, but there's still gaps that we could work on. And I will say,
I'm sorry, please finish.
I was just going to say, I will say for disparities, while white residents do have the highest incidence, it's likely possible that Black residents were just not getting the care to start with, therefore facing higher mortality.
My question is about demographics of mortality. Do you have any information on the age brackets of those who die of cancer in our area?
Yes, so we got this information from DPH and they do have those rates. I don't have them off the top of my head, but I could get those to you. So if you
I'm just curious as to whether it holds here as it does elsewhere. And there was an earlier data point that would support this, that Concord had a higher COVID death rate than any other community. It was interesting to see that in your earlier bar chart. How much of, what percentage of the deaths are people 55 and older? Nationally, it's 3/4. I'd be curious to know whether that's, because I took from that earlier bar chart that maybe there's an elderly component to the health issues in Concord, and I wonder how that bears on cancer mortality here.
are you referring to the COVID-19 bar chart?
Yeah, the COVID-19 bar chart had how many people died in various communities, and the highest bar was Concord, even though it was lower on a bunch of other metrics. So I didn't ask the question at the time, but I added 2 and 2, maybe got 6, but I assumed age or had something to do with the vulnerability. And so now I'm asking the age issue for cancer deaths. There's increasing cancer incidence of some cancers in younger people, but the mortality still is holding at 3/4 or so are in people 55 and older nationally. And I'd just be curious to know what it is here. Sorry,
Yeah.
you don't know.
No, definitely. We do have that data, so I could get that to you after. I just don't have it in front of me.
Yeah.
And Kimberly, correct me if I'm wrong, but I do believe that the death rate for Concord included deaths at Emerson Hospital. So not necessarily people who lived in Concord, but
Oh,
the deaths occurred in Concord.
makes sense.
Yeah, my feeling about it is that the Concord data is a little skewed because of the hospital. We're the only ones with a hospital, and if that data includes the deaths at the hospital, well,
Yeah, so if the mortality rate counts as who dies at the hospital, it goes on Concord's rolls. Okay.
Right. So in Maven as well, when we recorded COVID-19 deaths.
it's not his fault, not his fault. Okay.
So I just wanted to mention, like in Maven during the pandemic, when we recorded deaths at like in Concord, they were people at the hospital, and we would just mark them as deceased. So that can definitely change the data a little bit.
Versus now, when you do a death certificate, this is with the town you do live in. But you could be in a residential living city, since so you could be in assisted living, that's where you live, that's where you pass away, that's what's recorded in your death certificate. All that,
Yeah.
so depending on like the town and how many assisted living or rehab centers or what your population, that can influence that data.
That's the where my question was more how old. And it's just a question that
They can find out.
Yeah.
She
Not
just
that
doesn't
you
have
would
all
have
the
all these
data.
data off the top of your head.
Probably there's a lot in there, but no.
Yeah, thank you, sorry.
Yeah, no worries. If you want to put your email in the chat, I can definitely
So
see.
why don't you email me and I'll pass it on to the
Thank you,
board.
Melanie.
There we go.
Thank you.
Perfect. Thank you.
Thank you, Katie.
Yeah, no problem. And so moving on to heart disease and hypertension. So as I mentioned, it's up there with the most causes of death in Massachusetts, around 20%. And it affects 8.3% of adults statewide for the prevalence rate. Hypertension in Great Meadows the rate is 33.8%. You can see the Mass rate is slightly above that. So it's the highest in Wayland and Sudbury and the lowest in Carlisle and Weston. And white residents had the highest hypertension rates, while again, Black residents faced worse outcomes, even though they had similar prevalence rates. And there are the Hispanic and Asian rates as well. And the Asian rate was lowest. So some prevention efforts are screenings like blood pressure clinics that your health department can do, lifestyle changes, a reduction in smoking and alcohol, exercising and diet, and community partnerships are other things health departments can work on. And so for asthma, the prevalence is almost 9% of adults in Great Meadows, and Massachusetts around 9.4%. So the variation between towns, highest in Sudbury and Concord, and the lowest in Bedford. In terms of pediatric cases, Sudbury had 46, Concord had 41, Weston had 34, Wayland 32, and Bedford 20. Carlisle and Lincoln each had 13. And so white residents had the highest prevalence, while again, Black and Hispanic residents had higher hospitalization and environmental risks, with Asian residents having the lowest. And so, as we all know, major causes of asthma can be environmental, such as air pollution, allergens, and maybe housing conditions that can disproportionately affect certain communities.
All right, and so I know we just threw a lot of information at you guys at a very late hour. So I just wanted to summarize some of the most significant health disparities that we observed while creating this report. So in Massachusetts as a whole, Black and Hispanic or Latino households were disproportionately impacted by the COVID-19 pandemic. A report released by DPH in 2023 revealed that Black non-Hispanic birthing people consistently experience the high rates of labor and delivery complications, followed by Hispanic or Latino birthing people. Black and Hispanic or Latino people with asthma had a higher hospitalization rate than white or Asian people with asthma. Older people with comorbidities who were infected with COVID-19 had an increased admission rate into the ICU and increased risk of mortality. And for communities to implement equity improvement measures, there does need to be an emphasis on the education around the why and how ultimately the whole community benefits from such measures, as a key informant who worked within the DEI space did talk about how there was a lot of resistance to their equity efforts. Next slide, please.
So as Kimberly just said, we did throw a lot of information at you. So just some recommendations that we had at the end for all the data was just promoting healthy lifestyle and screenings and preventative care for your communities, improving access to affordable primary care and preventative care, investing in mental health services and social supports, which a lot of the towns already do have a great mental health service that rides along with their police, which is great. For community design, just making sure that your communities are walkable, bike friendly, and have inclusive public spaces as well as public transport options. And then in terms of health equity, just expanding your culturally competent outreach. So in all of your programming, making sure that you have other languages or translation or interpretation services, improving representation in the healthcare workforce and leadership, and really making sure that these community voices have a voice in the program design itself and decision making. So just that they have a seat at the table. And then for environmental health, making sure that we keep an eye on air pollution and climate-related risks, while also addressing social determinants of health, such as housing, transportation, and food access in our communities. And our main goal throughout all of this is just using local zip code level data to guide our programming and making sure that the initiatives that we are doing are going to be helpful to our communities. And since COVID-19, strengthening partnerships with the residents is very important. It does help the rest of our public health initiatives as well land better. And overall, strengthening regional public health infrastructure is important to support our local health departments. And Kimberly and I just want to thank you for your time tonight and all of your great questions. Does anyone have any other questions?
What's the frequency of this survey? So this is obviously the 2024 version. Has it happened before, and when might it happen again?
So this, I believe, is the first one. And I did see some talk of another one opening.
From the state or from you?
From the state, yeah.
that'd be interesting to do it again in 5 or 10 years and see if there's any changes.
Right, I mean, hopefully they do it again in 5 years.
Yeah.
My hope is that they tell me before 5 days before it closes.
Yeah.
So we can,
Get more reliable data.
cause we did our
Yeah.
own needs assessment because
sure.
we were unhappy with the data representation in our town, but. We need to be more efficient with our efforts, we kind of learned that that's a endeavor to. And we need to figure out a way to partner with Emerson Hospital and their needs assessment and the state, what they're gonna do on and use that to promote and get answers from data from Concord. It's a good learning experience.
Of the Great Meadows community, which has the highest influx of people who are new to the United States?
I think at least when we were doing the survey, well, Bedford and Concord both had the
It's not
shelters.
relevant anymore, David.
Yeah. So we no longer have
Yeah.
shelters, like, as they were closed.
Yeah.
During the time of this report, it was relevant, yeah. But it's not the same at this time.
Thank you.
Okay, I think, thank you for that report. I think we should move along just in the interest of time, for board member reports. I did attend the, this morning, the chair's breakfast. I just kind of brought to their attention that we did hire a new, public health nurse. I also mentioned, about the flu, clinics, and I actually gave them the numbers of how many people
Okay.
were vaccinated. But that might kind of help at least motivate those who are listening in.
Mhm.
I discussed the opioid settlement money and where it was being allocated, to, especially the outreach, with the survey,
Mhm.
that we were conducting. And then I mentioned the Yellow Tulip Project for mental health awareness. So I think they got a pretty good update. I'm not sure if I'm gonna be able to make the January one, depending on when it falls. Right now I'm gonna say no, so we'll probably need, coverage for that one when the time comes. And then unfortunately, they give it to me sort of short, but do you think you might be able to do it, Johnny? Oh, great, okay.
Yeah.
It's typically the same day as our board meeting.
Okay.
Yeah.
So it must be the third Wednesday of the month
Mhm.
is when
Yeah.
the chair's breakfast is, and we haven't had our board meeting yet. So I end up invariably talking to whoever's going about what are we gonna say, cause we haven't had the board meeting yet.
Yeah.
That's fine, you can just reach out to me,
Yeah,
and
and if
I'll-
there's any reason I can't make it, I'll let you know.
I'll get, yeah, if you just let me know, and then I'll reach out to the board, or Kimberly will, and we'll find a replacement. Or find out if anyone's available, like,
What date is that? I'm just gonna put on the calendar right now.
you had asked that, Dottie.
Mhm.
Let's see,
January 21.
thank you.
Thank you.
I'm gonna say right now, I wouldn't be able to make that one. Any other boards that, others that would like to report? David, anything new on that?
No, it's more abundant until the spring, the
Okay.
2229,
It's kind of on a freeze for the winter.
nothing doing with it, and so, no.
Okay, excellent. Anybody else? No? Okay. I guess we'll move along to the public health nurse report. And again, welcome to the group.
Yes, I'm glad to be here. Hi, I'm Katie Stanislaus, the new public health nurse.
Nice to meet you.
Yeah, so in front of you, you have the communicable disease report. This is for November. This is actually before I started. So this is Katie Rhines, the regional public health nurse, was taking over for that when Maura left. So you'll see in front of you, we have that report. Some of the things that I've kind of been working on, as you'll see, we have the winter safety flyers. Those have been fantastic. We've been kind of distributing those around town, the COA, the library. Narcan, we've also been reporting to the state on that. I've completed the Maven training and I've been certified in that. So I've actually started officially today doing that, taking over for Katie Rhines.
Katie, can I interrupt?
Yeah,
These are awesome.
yes, those are from the Great Meadows Collaborative.
Yeah.
Yeah,
Any
so
chance we could put them in gas stations?
You wanna volunteer to do that?
Yeah.
Sure. How many do you want? And I'll.
Well, I'm
print
gonna
it out
ask
for
the
you.
gas stations first. I mean,
Okay,
it just occurs to me that, that would.
if you want a stack and you wanna go door to door, Knock yourself out.
All right, come by and get a stack and
Okay.
knock myself out.
Okay, we'll print some out for you.
Yeah, we can do that. Also just been making some general introductions with everybody, the COA library, everyone's been great to meet. And then we also held the health communications group, and that's to kind of find ways to advertise the community clinicians. I know you're talking about also barriers to maybe access to care. The community clinicians also have virtual options as well for people. So that's something to consider, you know, the stigma surrounding mental health access. So that's another way that we've been advertising that as well, the virtual options.
So we talked last month a little bit about some ideas, what to do about the community clinician. And so we had, I invited the whole behavioral health collaborative. We had a handful of people get together and brainstorm with some ideas, and we should have more to report next month.
Yeah, I was sorry, I was invited and I was sorry I was unable to
That's
attend.
totally fine. I mean, inviting the collaborative. But but we had some good representation and some good ideas, and we'll report back to the collaborative, we'll report back here. And maybe we'll get some other feedback and ideas. But to try to increase the awareness, so the survey that Olivia Dufour is doing about opioid, one of the extra questions, if you're a Concord resident, asks you, do you know about that we have a mental health clinician? And 75% are saying no. We had 300 respondents, they say no. So even though there's other barriers, as they pointed out, to why we might not see a mental health clinician, the first one is that they don't know we have one.
Let me
So-
reiterate, maybe this is time to do so, a suggestion they made a long time ago, I forget where to whom. About the bridge, I keep bringing up the
Yeah,
bridge.
we heard that's in part of the plan.
And a specific idea to facilitate that would be to talk with the mental health care providers to find someone who has availed themselves of the service, who is willing, even if anonymously, to share their personal story, so that when we go to the bridge, or whomever goes to the bridge, we say, we're not just asking for an announcement that these people are around. There's a story, a human story that appetizes, it gives it a peg, it gives it a much more attractive way of getting the availability of mental health services into something that reaches everybody in town by having a story ready to go. So that would be internal homework. The mental health care people would have to consider whom to,
I just think
Yeah.
that breaks every HIPAA rule on the planet,
yeah.
David, like every single one.
So as a reporter who did this for
Uh-huh.
a long time, there are ways to do it that don't. Cause you get the person who, so it's a one-on-one conversation. I don't have to go into the details. You have the person who's willing to share the story. You have the people who are providing the services contact them anonymously. So no HIPAA is broken, and ask them if they're willing to share in order to broaden the awareness of the service. Basically, that's the idea. So you can avoid the violations that would be obvious, and make it a more attractive way of reaching everybody with the service. But to be discussed, I just wanted to reiterate that. as a
Yeah,
possibility.
if people have stigma to even reach out because they're afraid they're gonna be known in the community, I struggle with that as a story. I struggle, but I'll think about it.
Well, and the Emerson magazine, for example, talks about specific patients all the time. It's obviously with the patient's consent.
Right,
So it would be, you know, the task for the behavioral health clinician to identify someone they think may be interested or excited to share their story even, and then,
okay,
but need to be asked in a way that doesn't kind of interfere with their care. Right?
Or broach their anonymity
Right.
until they're willing to do so, but like the magazine does, and it can succeed.
And you're right that those personal stories are really kind of what capture people's attention and
It's gonna get it in the bridge, and without it, it probably won't.
well, I'll bring it up to our provider and approach them. It's beyond my expertise.
sure, fair enough.
I'm gonna
Yeah.
own that.
And nothing that I've done either, but no, I think the Emerson magazine is a good kind of example of
Okay.
where that sort of thing is done.
How about just kick it off, like do an article, like meet the public health nurse and do a little interview with you? That'd be great, and you can kind of get the ball rolling a little bit
Yeah,
out there.
that's an option, yeah.
Yeah, I don't have any connections with the bridge. Do you, Dan?
Well, yeah, I have connections with them. We have to make the story attractive to them. Just because I know who the people are to call and they'll take my call doesn't mean they'll go okay to the story. So as a reporter, as a journalist, and as someone who advised people on how to get stories in the newspaper, a new person, there's the peg. It's not the you, it's not what you do, it's the new. Yep, there's the peg. Like the other thing would be the peg of having the human story. And by the way, I can help with, if you or whoever goes to the mental health care professional and proposes this idea, I can help with that conversation too.
Okay. Duly noted.
And Melanie, I noticed you were in the paper this last time with the reutilization of the former, I guess, the hotel piece they quoted you in.
Oh, yeah, they did,
Did they see you in
they
that?
did interview.
Yeah, it's a good piece.
Yeah.
It was
I
interesting.
didn't read the
piece.
piece. I knew I was interviewed, but I didn't see it. I
Yeah,
have to check
it was
it.
in, I want to say the last, did you see it?
Yes, yeah.
Did you guys see it? Yeah.
Yeah.
With the
And you
phone-
and I keep driving past that, I presume you're down the hill, right? And I never realized it had tried to reopen.
Reopen, yeah, that was interesting.
You know, I never
yeah.
thought it had done that. I just keep waiting for the pizza place.
Indeed. Katie, where were you before coming here?
I was at an urgent care mostly.
Okay.
Oh,
Is this your first public health nurse job?
Yes, first public health nurse job, so a lot to learn.
Yes.
I'm excited.
Katie
yeah,
worked
It's good. It's a
you
good
know,
place to be.
in emergency preparedness. She's got some good experience,
Nice.
you know, kind of immediate post COVID or in COVID, emergency, you know,
Wow.
some,
Yeah, where were you?
I was all over. I was working alongside FEMA, so we're in Oregon, Louisiana, New Jersey. We did some
Wow.
work. Yeah, it was a lot, but it was
Yeah.
exciting.
Yeah.
Good time to come up through.
Yeah.
Okay, and then, again, I'm sorry, were you done?
Yeah.
With everything that was it? Okay, I don't mean to cut you off. And then, public health director report.
yeah, I'm ready. Well, my most exciting news we've already talked about. I had two staff start on November
Yeah.
24th. I have Kimberly here as an admin, the office coordinator, and Katie as the public health nurse. So that's pretty exciting for me from a workload standpoint.
Yeah,
To fill those positions. We are in first and second round interviews for an inspector, because we still have an opening for inspector. So that's, I've had a couple second round, we'll have another one tomorrow, so we're still in process for that position. I did learn recently that in hybrid meetings like this, we have to have an in-person quorum. So that's just, I didn't know that, but I
is
think
that new or is that?
I think that's been existing, I don't think I knew.
Okay.
So you can be 100% hybrid, 100% on Zoom. You can be 100% in person, you can be hybrid, whichever you. But if you're hybrid, your quorum has to be, you have to have quorum in person.
In the room, huh? Interesting.
So it's something with all of our schedules and timing. Sometimes we've had people switch last minute. And so, like, oh, well, I'm not gonna come, I'm gonna be hybrid, which is maybe okay, but maybe not.
Depending on the form.
Depending on
Yeah.
what the quorum is. So just, I'm asking everybody to respond to Kimberly. And she's gonna keep track of that. And if you have a change, no, you know, we'll accommodate whatever we can, but then if it breaks quorum, we're gonna have to, you know,
Does that mean we have to
Understand.
go fully Zoom and then that?
well, if
would
we've already
qualify?
posted it, we couldn't.
You couldn't, you'd have to cancel the meeting.
Right.
Okay.
So we just add some logistical
Gotcha.
things with your schedule. Of course, things come up last minute, but
Sisters had babies.
yeah, they're allowed to do that.
Yeah.
But I just.
I will
want-
say at one point we did joke, like, should we put what's going on video?
No.
Which
how
we
many
didn't.
is it?
Well, you could have just told her to have a scheduled C-section so you could have been
Well,
here.
I told her, I said, you gotta keep, the whole birthing story really was perfect for the Board of Health. COVID, emergency C-section, husband got COVID, so we covered it all.
Wow.
Oh my gosh.
I know.
Oh,
It was wild, but they're all doing great now.
Well, if you're in Emerson, we could have moved the whole meeting over to the LFD one in Emerson.
Yeah, you guys should have just come
I
to
would have loved
Pasadena.
We are, going to be working on we did complete our budget for, we did put no capital requests in. For us, the only capital request is usually a car. I got a hand-me-down car last year, so I did not put a capital request in this year. and we submitted our operating budget. So that's some of the work that's been going on. We will, I did email you today, Jim, be drafting a year-end report. The board does typically some more in the annual report, a year-end report, as does the health division with subparts of nursing, with our data. So we'll be working on that. We owe that to my boss by January 12th. We are working, as Katie mentioned, to continue to, we did our needs assessment to refine and get our health improvement plan in place and get that documented. We did implement, and in your packet, which was not originally, it's a new ad today. Sorry, Portia, it's in there now. A fee increase. So as part of the select board's FY 25 goals, we were asked to evaluate our fees. And my memo to the town manager is included in the packet, as well as the existing average for surrounding towns and proposed fee schedule that was adopted by the town manager. That's her authority under our bylaws, so I'm telling you about it, but that decision's been made. So those are going to effect January 1st. It's on all of our websites, working with our software, permitting software to make it happen. There is not, we didn't 100% increase where we were higher than most in some of our food permits. I went down or made no change. Okay. Deliberately did not change the hazardous chemical permit, because as discussed with this board in the spring, I hope to address that whole regulation, and we'll talk about the fees and what that looks like. I just haven't had the staff to do that, so hoping that will come back in 2026. We also worked on the select board goals individually. Each person has now this year 2 goals. That is I don't call them reach goals this year, but there's a bonus stipend, expect if you reach those. They're not your day-to-day job. They're extra stuff that you do for the town that that you can get up to a certain percentage bonus if you complete them. So everybody had to submit those last month and have those approved. And that's about all that I have for active
Okay.
activity. Any questions?
I know that during today's meeting, everything was kind of gearing up towards end of the year stuff and then getting ready for town meeting and getting articles.
Correct.
I don't know if we have anything, do we have anything that we wanted to submit or anything that would go in front of town?
I don't think we're quite, we're a little late. I mean, they have to be
I think it's the 29th,
right.
no later than,
Well, the
The 9th.
staff ones have to be there on the 9th of January. The only thing I'm trying to define, we do a betterment loan program. And I'm trying to understand, how much money we definitely have left. And I think it's less than 150,000. And if we need to go before town meeting to be asked to continue, it was a $2 million, like in 2009, it was a $2 million, like town meeting approval to borrow that money, which was no interest, that we then pay back, and then we get, as a state, like we borrow it, we get paid, the people pay us back, we pay back the state. It's like a transfer of money.
Help me, what's it for?
The betterment loans, when people have a failed septic system,
That's right, I remember.
they have to have a failed septic system.
And we
they
can help you fix it.
You can borrow at very low interest, up to $30,000, and you can pay it back over 10 years on your Q3 tax bill.
Thank you. I remember this from somewhere else.
So I feel it's pretty, one of our strong equity, pieces. If your septic system fails, that as of right now will still cover a 3 and 4 bedroom septic. It doesn't cover a larger septic. Now the cost is up over 30,000 for those. But it does help people that have a failed septic, that want to repair it. And so, the only thing I would put for a town meeting that I know of right now, is that but I might run out of time right now. It might be like have to make it the docket next
we
year.
have to do it this week.
Yeah, pretty much. I'd have to, know that the state and get this, has that available. They have it available, but, put it forward to say, okay, with approval for us to use, do this program.
On 150,000 left out of 2
2
million,
million,
but over 15 years.
correct.
So, I mean, it doesn't, It's not fully depleted.
No, and
Right, I mean, there'd be
the-
30,000, you know,
the challenge is,
yeah.
like, I'll have none for 6 months, and then I'll have 4 coming.
Oh, sure, yeah,
So it's not an even,
yeah,
like, if you look at the data and then trying to predict, like, or.
Potentially your septic failure.
Yeah, if you're trying to have a rate of
Yeah.
use,
Mhm.
it's over the
It's
time, you can do a linear.
average it, but it's.
But
not
over,
accurate, yeah.
that's not how they come in, they seem to
Right.
come in like, I'll have 4 at once.
Yeah.
That are, and then I won't have one for a long
Once the
time.
funds are gone, then there's no.
Then I
ability
won't,
to
I
offer
won't be able to
that.
offer that
Right.
anymore.
That
So
makes sense, yeah.
I don't know if the timing is gonna be possible, it's taken me quite a bit of time to just. But our new CFO is very responsive and working with me with the state to get the answers we need.
Okay,
So
good.
That's the only thing that's on my radar.
Excellent. Okay, thank you. So public comments, again, I don't see any. Usually you have a name or something. I know there were a few names up there, but it seems like it would be common.
Everybody seems to I'm sorry, this.
Have a cookie.
Oh, no, it's not, cookie's not gonna help. I think everybody's gone. I don't even get even
Gone?
toggle anymore. No.
Okay, so the last thing is to adjourn and so we have a motion.
I move to adjourn.
Do we have a second?
Second.
Okay, all in favor?
Aye.
Aye, okay.
Aye.
Right.
Thanks, everyone.